already have your excision and your repair on your mannequin, and you would come in to prep the patient for the doctor. So you want to make sure that your patient's positioned correctly. So let's say if the patient was on the back, you want to go ahead and lay them flat, make sure they're comfortable right on this side. If they're going to be doing on the leg, make sure that they're comfortable. If they're super stiff, you position the table as needed. We have the remote right here on this side. So, up and down. For the legs, tilt, upper, and then this is to bring it higher or lower. Okay. So once your patient's comfortable, you also want to go ahead and come back here. Make sure they sign the consent. If they didn't, have them sign it. Make sure that they understand what they're getting, the procedure that they're getting done. And you also want to make sure that if they have any questions, that you know that beforehand, maybe you can help them answer, or if not, you can double check with Elika, sometimes with Elika, because they'll have billing questions sometimes, or if it's a medical question, you can help answer it or ask Dr. Kormeili. Once we have the patient ready, you go ahead and step out of the room. The last thing you want to make sure of is that they're wearing the proper clothing. If not, we give them a gown. So if it's for the back, they might need to take off their shirt. If they're going to get cold, some patients are fine just taking off their shirt. We do have gowns as well. And we also have shorts. In case it's on the leg and they're wearing pants, we can have them put on shorts. If it's like on the upper leg, we can go ahead and give them a gown and they can just cover themselves on the other areas. Make sure that they're changed accordingly. We go ahead and step out of the room. Once we come back in with the doctor, we'll go ahead and have everything ready. Let me go ahead and just pull that sterile off again. So the doctor will come in, she'll ask the patient if they have any other questions. She'll kind of talk to them to like ease their nerves. Once she's doing that, you want to make sure that on your iPad, you pull up a picture of the biopsy that got done. So the way you do it is you are on the progress note and you would go ahead and go to pictures right here. So let's say this is the biopsy site. You have that ready, so Dr. Kormeili knows exactly what to mark. Okay? She'll go ahead and grab the marker. You show her the photo. She'll go ahead and mark the area how I showed you guys. And at that time, she'll confirm that it looks exactly the same. We go ahead and put close. Go to our mannequin. Click on the excision and repair. Go to the scalpel, excision, pre-op images. We need a photo of the markings. So we would go ahead and click here, take photo, go to our patient, and take a photo of the markings. We go ahead and put use photo, press done, and we have it right there. Now you want to keep this up because you're going to go ahead and work your way down as the excision is being done. Okay? So you go ahead and leave this here. Dr. Kormeili will start numbing the patient. If she needs more lidocaine, I ask her. So if she's going down to, like, you see her like at 0.5, you want to let the doctor know, will you need more lido, doctor? If she says yes, you start prepping the other one. So remember, we need to add sodium bicarbonate to it and then put the 30 gauge, hand it to her. She'll give you the used syringe. You'll go ahead and just carefully grab it, place it right there, go ahead and dispose of it. Okay? If she doesn't need more lido, she'll tell you no, it's fine. And we can just go ahead and let her finish. She can hand you the syringe, you go ahead and dispose it the same way. Then we'll go ahead and start getting ready to be sterile. So she'll start putting on her gloves. At this point, you should know how much lidocaine the doctor's injecting. So if she injects the full syringe, it's going to be 3 ml. If she injects two full syringes, it's going to go ahead and be 6 ml. If she does 2 syringes, but one of them is full, and then she used all of it, and then the other one she only used 1, then she used 4. So you want to be aware of how much she's injecting into the patient, because here, anesthesia it will ask you how much was injected in there. So you don't have to do it here, but you have to keep track of how much she's doing, injecting. If it helps you, you can grab your pen. Let's say she injected just one. You can quickly write 3 there, just to help you remember, okay? Doctor will go ahead and glove up. You'll glove up as well. So by the time she's gloved, you should be gloved as well. So practicing how to put them on really helps. I'm just gonna put these gloves because I don't want to waste. So you'll be sterile. Dr. Kormeili will go ahead and grab this. Like I said, she'll place it on the patient and then she'll go ahead and grab the other one. When she starts the surgery, let's say, can I borrow your arm? So let's say she is going to excise around this area. It's our job to stop the bleeding. So the whole time, you can use Q-tips and gauze to help the bleeding stop. So let's say that the elliptical is like this. We want to go ahead and keep dabbing the blood away. If it's a very small area or you can't get to the gauze, you can use Q-tips there. Also, to stop the bleeding from veins, you can apply pressure on the sides of where the elliptical is. Do you want to add anything to that?
Yeah, that makes sense. Because remember that blood vessels come in 3D. What's that drawing you did?
Underneath the consent.
Drop like this. So let's assume this is our wound. Right? So, can we still use your... So let's say this is our boo-boo, okay? So now blood's going to be coming out all through here, right? So what we want to do is, when we want it, first we need it to be dry. You cannot use the hypercator on a wet, bloody surface. So to stop the bleeding, I'm going to be using this, obviously with gloves. What the assistant does is you pull the edges away so we can visualize where the blood vessel's coming, but you also remember the blood vessels are coming like this, right? So if you just push it, but you don't press down, you won't compress the blood vessels. Does that make sense? So you want to stop it, like if your hose was leaking, you want to go to where you can like put pressure and it would stop the leak, right? So we basically visualize it. Now, you want to make sure that like your fingers are not closing it so we can't see where it is. So a lot of times what we do is she has gauze and I have gauze, or we have Q-tips, and we do what's called a rolling motion. You roll over and you hyphricate under. Is this on?
Yes.
Okay.
I was like, wait, don't
So we roll over it till it's completely dry. Once there's no more bleeding, right, you let go. Now, when you're assisting, you have to be really careful that your fingers don't get stabbed, right, because there's going to be all sorts of sharp stuff. So you don't want to put your fingers on the edge. You want to be kind of out and about, right?
Like about here.
And then when we're just going to pretend this has sutures, we drive in, and then your job will be to cut the sutures. There's 2 types of sutures. There's the ones that are buried, and then there are the ones that have a tip to them. So whenever we do surgery in derm and plastics, there is a type of suture that is absorbable. That's the skin-colored one. It's made out of sugar, so it just dissolves into the skin. It takes about 3 months for that to dissolve. This holds the wound together. And then this is the one we take out at suture removal. So it's either blue or black, okay? And you can see that on the outside. And that's the one you will learn how to take out. So then once we're done with the surgery, the most important thing now is not to lose the skin specimen, right? So the first thing we gotta do is transfer that into the bottle, right? So now the surgery is over, so you can touch stuff and yeah, because you don't have to worry about sterility. We have to make sure the bottle is done, the bottle is watched at all times, because there's no point taking out a cancer if we don't know the pathology came back clear, right? And then the next thing is to take care of the patient, get them stabilized. What we do is we usually cover, so remember we have all of this stuff, right? So this usually is not bloody, this may have blood on it. We don't want the patient to see how much blood they lost, it just makes them queasy. So you put everything on and you quickly hide your tracks, right? So they don't have to see anything. The specimen has been taken care of. The bloody stuff is all like hidden. Now we take care of the patient. And we have to do their post-op dressing, go over post-op instructions, and show them all the packets. And then Karen can show you how to like break down this, and then we are gonna put it and soak it.
Perfect. Yes. So once we go ahead and do that, we have our specimen safely in here. You want to make sure that we fully close it, and then you keep it safe. Don't do that. You either leave it right here, and I like to either leave it by my iPad so I know that I'm not gonna forget it, or I can put it in my pocket so I know it's with me. If you put it in your pocket, you have to remember that you have it in your pocket. So let's say we're just gonna leave it by the iPad, and we're gonna do the pressure dressing for the patient.
And then remember, at this time, we don't have a label yet. You haven't printed it, right? But let's say the patient's name is John Smith. Put John Smith on it. So if you came out and like we did like 2 more surgeries and you have all these bottles, right? You immediately want to make sure, right? The other thing is like don't lose the specimen identity. So you want to make sure you take it out and you're like John Smith, the label you printed, and that's taken care of. It's the first thing you want to do when you get back to the lab, because you don't want to leave it in there and you do another surgery and they look identical and one is John and one is Jane, and we don't know which is which, right?
So once we have that, before you do the pressure dressing on the patient, we do need a picture of how it looks with the sutures. So we took our pre-op here, however, we need it in their repair, the picture with the sutures. So we're gonna go ahead and hit close. We're gonna go to repair complex, and we're gonna have post-op images. So we're gonna go ahead and take a photo, and it will be of the area with the actual sutures on it. You go ahead and put use photo, and it's gonna go ahead and be right there. You also wanna pay attention to Dr. Kormeili when she tells you the final measurements. On the scalpel right here, there's usually a ruler. So the final length, Dr. Kormeili will go ahead and measure it and she'll let you know. So you wanna go ahead and make sure you remember that. If she happens to not tell you the measurements, you always wanna ask her. So you can let her know Dr. measurements, she'll measure it for you. Last resort, if that doesn't go well, you can either do the scalpel, just make sure that it does have a blade, so you want to be really careful with it, or you can use this ruler to measure the length. We measure the length from the suture points, okay? And we always do centimeters, so you always want to make sure you know that. Again, if you're gonna forget, just make sure you write it here. So let's say final length was 3.2, and now we can go ahead and do the pressure dressing. So what you're gonna do is you're gonna go ahead and
Do you want to apply it to?
Yeah.
If you want to do another video, because I was getting so